Hi, my name is Carly Auer, and I'm a classical homeopath at Our Family Homeopathy in Mesa, Arizona. I have two children who have been raised on homeopathic medicine. Homeopathy has been such a gift in our lives, and I'm so happy today to be here to share it with you. I'm a graduate of the American Medical College of Homeopathy in Phoenix, Arizona, and on behalf of AMCH, we would like to welcome you to our new self-help homeopathy program. I invite you to visit us at selfhelphomeopathy.com. We have 30 different programs in a variety of topics, from acute back pain to cold and flu to autism spectrum disorders. The great thing about these programs is that in addition to focusing on a specific ailment, they also offer an introduction to general homeopathic and holistic medicine. So if you've ever wanted to learn about homeopathy and how it can help you, this is a great place to start. Visit us at selfhelphomeopathy.com.
Here is a brief clip from this program suggesting homeopathic remedies that are useful in treating this condition.
Next is weakness as the main presenting symptom in flus. Here is a case of a 35-year-old woman who 4 days ago heard that her sister had died in a car accident. Since that time, she has slowly developed symptoms of influenza. She feels worse in the mid-morning and is having much dizziness that accompanies the symptoms. She has left-sided coryza, or nasal discharge. She feels sleepy and has difficulty thinking clearly. She has 102-degree fever, but no thirst, and has headaches that seem to generate from the back of her neck. So this is a classic description for the remedy Gelsemium sempervirens, or yellow jasmine, which, as I mentioned before, is one of the remedies that is most commonly indicated for flu. So yellow jasmine, or Gelsemium, is probably the first remedy to consider for an individual who has never been well since the flu. And this can go on for a long period of time. They just never seem to have recovered. Gelsemium is also one of our slowest of onset of remedies. Typically taking 3 days to really begin to manifest symptoms. The keys for Gelsemium are the 3 Ds, and that is dizzy, dull, and drowsy. They have a lot of dizziness and vertigo associated with their symptoms. They also typically feel very dull and have difficulty talking or expressing what they're experiencing. And they're very drowsy and they sleep all the time. Gelsemium is one of our main remedies for stage fright. It also is indicated when the flu comes on after some kind of shock, emotional shock. It also is our main remedy for flus that come on during the warm season as opposed to the winter months. There is a feeling of heaviness throughout the body, particularly in the eyelids, which can be drooping. Also, they are so weak and so fatigued that there can be tremulousness of the hands or extremities and extreme muscle weakness. Typically, Gelsemium will desire to be alone and to be left alone. They will have chills associated with their fever, and classically their chills will run up and down their back. They also are vulnerable to headaches. And the headaches classically start in the back of the head or the occiput and travel over the top of the head into the forehead. And again, worse from bad news, worse from fright, and worse thinking about their symptoms. There also is thirstlessness associated with Gelsemium that can help you to identify this remedy. And this was from Borland in 1939. Visualize the ordinary typical influenza case, probably developing over 6 to 8 hours. Patient feels a little out of sorts the day before, possibly a little headachy, a little feverish, has a little indefinite pain, is probably a little catarrhal. He goes to bed, does not sleep well, and next morning feels rotten. Fortunately, there is a drug in the Materia Medica that produces exactly that picture, which will cover a large percentage of the cases of straightforward influenza, and the drug is Gelsemium.